So welcome everybody to our 6th annual San Francisco Columbia Alumni Startup Demo Night. It's a very long name, but we want to make sure we pack all of that information in there. This is the first time that we're ever doing a virtual demo night. We've done many demo nights in person. Some of them have been small, many of them have been big. And I'm sure that many of you have attended some of those demo nights. But this is new for us. Tonight is a bit of an experiment. We're feeling good about it though. For those of you that have just joined, there was actually a small pre-networking event that we did with an app called Upstream that allows you to video chat with other attendees outside of the main session. So we're thinking about other tools and things that we can do to make these types of events more interesting, because we know everyone has Zoom fatigue. We know that it can be really hard sitting in front of a screen all the time like this, but we're exploring ways to make it a little bit more fun and a little bit more engaging. So let's get started. We have a lot of great content tonight. We have a huge number of panelists that are on that will be speaking. But before we begin, I just want to remind everybody of some basic ground rules. Since there are so many panelists, please remain muted except when speaking. Now, there will be some times during the pitches and probably during the Q&A when some of the judges will want to speak, and that's fine. So if you have a question or you want to speak up or interject during Q&A, that's totally fine. But for the rest of the time, we ask that you please remain muted. So a little bit of background on CVC. I'm going to give more of a history in a few minutes. But we've been around since 2006. We've been doing demo nights like this for over 10 years. Our biggest demo nights have traditionally been in New York and San Francisco. We have our 10th annual demo night in New York happening in a couple of weeks. This is the 6th annual one for San Francisco. And we're going to be holding demo nights in London and Asia for the first time as well this year. So we actually have a series of 4 demo nights in a row in the span of about 2 months that we're very excited about. So I'm Ryan McCarrigan. Many of you know me already. For those of you that don't, I'm the global president of CVC. I've been in this role for a few years and have been involved with the leadership of CVC for about almost 7 years. I'm a CC08 graduate from Columbia, and I work in design and innovation. I work with startups. I work in the corporate innovation space, mostly around teaching lean startup. And I'm going to turn it over now to Cortland, our global VP, so he can introduce himself.
Thanks, Ryan. Hi, everyone. Thank you for tuning in to our first virtual demo night for San Francisco. We are super excited to have you, the judges, the pitches. It's really an interesting time, obviously in the age of COVID, but more importantly, to bring people who are interested in spearheading new ventures in the health tech, healthcare space, which we all know is pretty, there's a lot of red tape. But the point of tonight is to help the startups who we've selected to get good feedback from the judges and meet a lot of interesting investors for further conversations offline. As Ryan said, my name is Cortland Thomas. I'm the global vice president for CVC. I've been involved for about 5 or 6 years, and currently I lead growth marketing at a life sciences biotech firm in New York City.
And Sunny.
Hey everyone, I'm Sunny Singh. I am the chapter lead for CVC in the Bay Area, Columbia College 2016 as well, and I worked at Corner Shop doing youth expansion, expanding us into the U.S. market. In terms of CVC, if anyone is interested in getting more involved in sort of the Bay Area chapter, or just curious as to what we do specifically within the Bay Area, feel free to reach out to me. I'm more than happy to talk about events that we're thinking about and how you can help.
Awesome. Thank you, Cortland and Sunny, for your support on this. As Sunny said, if anyone is based in the Bay Area and is interested in getting involved with CVC, please let us know. And we'll have a slide at the end that tells you how you can reach out. And also briefly, Dan Lee, do you want to say a few words about the partnership between CVC and NorCal?
Yep, absolutely. Hi, everyone. I am Dan Lee. I'm the Vice President of the Northern California chapter of the Columbia Alumni Association. I graduated from the School of Engineering in 1991, and I work in finance. And just a very quick word on our club and our relationship with CVC. Our club is the umbrella organization that serves the alumni from all of the undergraduate and graduate schools at Columbia. And amongst the various verticals that we're active in, entrepreneurship and innovation is one of our most important verticals. And within this space, CVC is our most important partner. So anyways, very excited to be here tonight. Thank you.
Thank you, Dan. Alrighty. So we're right on time already. That's amazing. So we want to go through some slides quickly, just to give you a little bit more background, but then, spend the bulk of this evening on our pitches. So I'm just going to fly through this, and Cortland, feel free to interject at any point as appropriate. So again, we were founded in 2006 at Columbia Business School. Many people ask us about the name Columbia Venture Community and are we just focused on venture? It's a bit of a misnomer. So originally the focus was on venture, but very quickly CVC grew to be a much more inclusive organization. And today, to borrow Dan's expression, CVC views itself as the umbrella organization for a lot of the entrepreneurial and innovation ecosystem at Columbia, because we are welcoming of alumni, students, staff, employees, anyone that's affiliated with the university and from any school is welcome as a member of CVC. So we sort of view ourselves as the glue between a lot of the different pieces of that ecosystem. We're considered a shared interest group through the Alumni Association, and we have nearly 6,000 members. A lot of that has been just in the past few years. We've seen a big uptick recently. We're almost at 500 events, if you can believe it. I think, yeah, tonight's 493. And we have members in over 50 countries around the world. So that's pretty exciting. Our mission is to foster entrepreneurship among Columbia University alumni, students, and staff by facilitating communication, providing access to needed resources, and creating a vibrant and supportive community. So this has been our focus for a long time. But something that we're really excited about moving into 2021, because of all of the crazy learnings that have come out of pivoting from an in-person events organization into a virtual events organization, is that we really want to double down on our mission. And we really want to make sure that we actually are fulfilling this mission for members now that we live in sort of this very different world because of COVID. And so we're going to be reaching out to members a lot more, getting feedback, sort of looking inward as well to make sure that the design of programs and events that we deliver to the membership is really fulfilling this mission, really catalyzing entrepreneurship. These are our values. I'm not going to read through them all, but we retooled these earlier in the year as well. And one of the things that we are extremely embracing of is diversity, equity, and inclusivity, but we don't want to just give those things lip service. We want to make sure that we really embody that on the global board and in the design of programming, and that we're really listening to the needs of our members, and that diversity of opinions and appearance and everything that makes us so great as an organization is truly reflected. So that's a big focus for us going into 2021 as well. We're human-centered, and we are always, proactively connecting, energizing, and educating our members wherever possible. Cortland, do you want to add anything to this?
Not much to add, other than that we are continuously looking for feedback on how we incorporate our values into our programming. With more than 20 chapters around the world and 6,000 members, it can be a little challenging to get feedback that is able to best synthesize the feelings of everyone in the group. But the only way we can move forward is getting a lot of feedback. So even though we have our values here, we want to hear from you through our member survey, through the survey from our events, on how we're improving the community for everyone.
Great. Awesome. So partnership-wise, you know, we work very closely with the Alumni Association, Columbia Entrepreneurship, the Lang Center, 500 Startups, and Wildcat and Green Fig, and we have other partners, but these are some of our key partners. In terms of global programs, just very quickly, we have some really cool programs that have just gotten across the starting line. And those are the Healthcare Mentorship Network. One of our judges tonight, Narmeen, is sort of the vision behind that. We're excited to have her this evening. And then we have our Female Founder Accelerator that's kicking off as well. But sort of broader and behind that, we've been doing a lot of online events. Cortland's been doing a really great marketing focused webinar series. I've hosted some webinars on various topics. And then we have what's sort of become our crown jewel is our venture engagement program, which Global Board member Rope Martula runs. And that's our low-touch facilitated matching program between Columbia-founded startups and our really awesome network of a few dozen venture partners. And so we look at things like team traction technology and other kinds of due diligence in those Columbia applicants, and then we make matches to that network. We actually will make introductions based on who we think would be most interested or potentially would want to make an investment in those teams. And about 1 out of 5 of those companies actually has gone on to receive funding as a result of those introductions. So we're very proud of that. And then something else that we're launching are premium educational workshops. I'm going to be leading that initiative into next year as well. We have a lot of events coming up. As I mentioned, we have some other demo night events. The best place to find out about these is on Meetup or by following our group on Eventbrite. And by the way, all these slides and a recording will be shared after this. So if you feel like I'm going through the slides really fast, that's just because I want to make sure we get to the pitches on time, and we're still on time. But we want to hear from you now. Okay, so tell us a little bit about yourselves. We'd love if you would open your chat and make sure that you select everyone. So all panelists and attendees is the option that I'm seeing for everyone. We'd love if you could do this in less than a minute. Where do you work? What's your current role? And where do you live? And we actually like to look at this in the chat record afterwards because we want to know who's here. So I'll give you a minute to do that. Less than a minute if possible. Wow, we have people from everywhere who are tuning in. Atlanta, Nashville, New York, Washington, D.C., Austin, Palo Alto, Palm Springs, Chicago, Cocoa Beach, Florida, Miami, New York, New York, New York. Very cool. All right, that is a minute. So let's move on. We are amazingly still on time. All right, so let's get to the main show, shall we? So we're very excited that tonight's theme is going to be health tech. This is also the first time we've done a themed demo night. Usually we just take teams from the local region, New York or California, but we had such an influx of health tech companies, and I suspect that Narmeen had something to do with that because of our wonderful new program and all the applications that we got for it. We decided to go through those, and there were so many great ones. We said, let's do a demo night themed around health tech. And here we are. So I'm going to give our judges the floor now. If each of our health tech judges could please introduce themselves for about 30 seconds. So you can unmute yourself, and let's just go from left to right, starting with Narmeen.
Hi, everyone. As Ryan mentioned, I'm Narmeen. I was CC08, and before I started my startup, which is a mental health startup, I actually used to be a healthcare investor in services, devices, and pharma. And I think the ones that would be kind of relevant for tonight is I did a lot in senior care, I did a lot in value-based care, I did a ton in mental health, inpatient, outpatient, substance use disorders, devices, basically kind of the whole gamut of things. And I'm very excited to be judging this tonight. And interestingly enough, I think Ryan was saying we've had a lot of great applicants to the health tech initiative that we've started. And so we're really looking forward to seeing more applicants in the coming years. We have a ton of VCs and experts that have signed up. And so, you know, if anyone has any feedback or suggestions, I'd love to hear it. Thanks.
Awesome. Thank you, Narmeen. And Bernard Moon.
Hi, I'm Bernard Moon. I'm a co-founder of Spark Labs Group. We're a network of startup accelerators and venture capital funds that has invested in over 280 startups across 6 continents over the past 7 years.
Wow.
So we're a relatively new firm, and I'm based in Palo Alto, California. We're mainly generalists, but we have been active in the healthcare, biotech, and medical device space. So.
Awesome. Thank you, Bernard. And next up, we have Chris Ho.
Hi, everyone. I was actually CC09 and also C's 2010. I work now at Vickers. Vickers is a venture capital firm that's headquartered in Singapore, but I'm coming to you from our New York office. We're a generalist deep tech fund, which means that we look at anybody who has some sort of proprietary breakthrough technologies, whether it's in biotech or AI or advanced engineering, nanotech, et cetera. We're now investing out of our 6th fund.
Thank you, Chris. Nathan, are you here? I know that you were having an issue with timing. Nathan Dow. Okay, I think Nathan has not joined us yet, but when he does, I'll make sure that he can introduce himself. Alrighty, so let's get started. So as a reminder to our startups and judges, the startups have 3 minutes to present. They're going to be sharing their slides on their screen, so I'm going to be handing it over to them to give their pitch. And then afterwards, they will keep their slides up for Q&A. So for those 5 to 7 minutes of questions, if you want them to go back to a slide or whatever, that's fine. But you know, we need to cap it at a maximum of 10 minutes for each team so that we can get through this. I hope that's clear. I hope that makes sense to everybody. So I randomly sorted the teams right before we kicked off, and this is the order that I came up with that came out of the sort. So we're going to start with Sentio Solutions and their Feel product, then memorywell, Graphite RX, DoBrain, and Fido. Okay, so that is our order for the 5 teams. So I'm going to hand it over to Sentio Solutions then. So panelists, you should have the ability in your interface to share your screen. So Sentio, whenever you're ready and you want to put up your slides, we can get started.
What are you seeing there?
Yep,
yeah,
we're in.
Okay.
Cool.
Excellent. All right, I will make this as quick as possible. So I'm Kim Warner. I'm actually the VP of Business Development for Sentio Solutions. Our founder is a Columbia grad, and I'm filling in for him tonight. But Sentio Solutions is the maker of the Feel program. It's a holistic mental health program that combines technology and science to improve a person's emotional state. If we look at the current paradigm, there's no objective measurement for mental health. So every other medical practice has objective measurement tools. So a thermometer, a stethoscope, blood pressure cuff, glucose meters, they're all examples. But we don't intervene until it's too late in mental health, leading to delays in diagnosis and treatment. The average delay between symptom onset and treatment in mental illness is 11 years. Sentio Solutions, we're changing how therapy is delivered using a wrist-worn emotion monitoring device and machine learning algorithms. So our solution enhances traditional care by measuring physiological data via our wearable and using that data to inform care with a licensed therapist. Our proprietary sensor and algorithms are commercially available for individuals with mild to moderate anxiety and depression. And we are also in the process of using our technology to explore and validate other mental health conditions like ADHD, PTSD, and bipolar disorder. Our proprietary sensors and algorithms are commercially available for, I'm sorry, I just read that. Our flagship program consists of 5 components. So you've got the feel emotion sensor, which is a wearable emotion tracking device that detects and quantifies a person's emotional changes. Number 2, the machine learning algorithms. They generate emotional alerts based on physiological signals. 3, the Feel mobile app, which responds to those changes and deploys real-time interventions. Number 4 is a licensed therapist for weekly sessions. And 5 is the proprietary 16-week cognitive restructuring program. The application of the program is that the participant wristband, and when an emotion is detected, the wristband will gently vibrate. The participant is prompted to complete a journal log. And so the journal log looks like this. These are the 5 screens that you will get on your application. So we ask you, what is the emotion? Name it. What was the intensity of it on a scale of 1 to 10? What was the event that occurred? What were the thoughts that were racing through your mind? And what were the behaviors that you were inclined to engage in? These answers are captured and shared with the licensed therapist, and the journal logs are the basis of the work between the therapist and the participants. So the participant meets with a licensed therapist virtually each week. The therapists are employed by Sentio and been trained on our technology and cognitive restructuring protocol. Our engagement in our solution is 3 to 5 times higher than other therapies. In between each weekly session, participants are engaging over 64 times with the app. And of those interactions, they're completing over 12 mental health exercises. Most significant is that 90% of our notifications are converted to mental health actions. This means that 9 times out of 10, when we send an emotional notification, the user is accepting and responding to that notification. We also have a customer satisfaction score of 4.8 out of 5 and 90% weekly active user rate. With such high engagement, we see clinically significant outcomes with a 67% reduction in PHQ-9, a 69% reduction in GAD-7, and a 27% increase in life satisfaction. This is over a 16-week course without any medication. So this is just some of the feedback from our individuals. We're growing and changing their lives. And lastly, we couldn't do any of this without our talented and dedicated team, our research partners, our investors, and our advisors. So thank you for letting us participate tonight.
Thank you, Kim. All right, judges, Q&A, 5 to 7 minutes. We'll let them gather their thoughts first.
I'll start. I'm just curious, who gets this? Because you talked about how there's 11 years between symptoms are showing up and a diagnosis. So by the time they decide to wear this, like when do you think you would fit into this cycle or progression?
Yeah, I mean, the idea is really about being, earlier on in that 11 years is what's going on, in the market today. So we are going into organizations and offering our tiered program, which is Relief and Feel. And Relief is mental resiliency for all individuals. Everyone can benefit from the mental resiliency. And when you go through our Relief program, which is a 4-week mental resiliency program, if we identify that you have indications for anxiety and depression, we will recommend that you go into the Feel program, which uses a licensed therapist and our wearable emotion sensor.
So it sounds like you guys have done actually a lot of cool and interesting studies. What areas are you most excited about? And can you talk a little bit about your roadmap for how you're going to seek clinical validation?
Yeah, sure, Noreen. I know you can appreciate us being a small company. So although we've got a ton of studies that are started, areas that we're interested in, it's it's really all about we're waiting for that someone to come and tap us on the shoulder and say, hey, I've got some money to back you on this application. But I will say that early, like the things that were furthest along are, so of course, we're already out with anxiety and depression, but the next thing in line is ADHD. We actually did, we have some early signals that show that we can detect ADHD within 20 minutes, and that's someone wearing our device and doing a cognitive behavioral exercise. So that's kind of promising because it's unusual to be able to get such, you know, a detection like that. And of course, I mean, PTSD is right up there. There's so many applications for PTSD, but we're also working on signals for, you know, bipolar disorder. But like I said, we have these studies going on, and it's like, you know, doling out a couple of cents across each study. So until somebody comes along and says, yeah, I'll you know, let's take this ADHD thing, you know, through FDA regulation, and that's what we're looking for too.
Those are actually really great areas because there's huge gaps in access, and like there's a huge demand for it. So it's really exciting to hear you're working on PTSD and ADHD. And very few people are, surprisingly, so it's very cool.
And I will say, we are open to any insights that you have. All knowledge is good knowledge. So happy to touch base with you outside of this too.
Other judges, questions? Wait a few seconds.
I can ask another one if you want.
Okay.
So can you talk a little bit, I imagine there's a lot of competitive advantages when you think about like the bigger, you know, the Amazon Halos, et cetera, that are coming out with wearables. Where do you think your biggest competitive advantages lie with some of these like big tech companies that are trying to enter into the mental health space? Yeah, so
my career is in the wearable space. I spent time with Fitbit at startup, Jawbone at startup, their wearables, at the very first wearable company back in 1999 called Body Media. If anybody knows it, anybody's from the Pittsburgh area, they'll know it. But so I understand these wearables well, and you know what the Fitbits and the Halos can do is that they can detect stress. Detecting stress is very, very different than what we are doing. We are detecting emotion. So that's why we have to create our own wearable. We don't love the idea of having our own wearable. We had to create the wearable because we needed that suite of sensors. We would be happy if if Fitbit had the sensors that we needed in their device, and we would just, you know, hop on that train. But we need a specific set of data. So we had to create our own wearable. But what we are doing is we are actually detecting emotional states. When all of those when all that data comes in, we can actually say, this is sadness, this is happiness, this is joy. So that is what sets us apart from anyone else. So when you think about Halo, or you even think about Fitbit has their new recognition around your mood. You actually have to be aware that you had an emotion to tell it. Same thing with a Halo. You actually have to, you know, tap it to record, to say, I know I want you to record something because I'm having an emotion. The advantage that we have, and we have years of turning this algorithm ahead of everyone else. The advantage that we have is that we are continuously monitoring you, and we are telling you when you're having an emotion. That's the beauty of our product, is when we can make you aware of the emotion, then we ask you to put some names around it, describe it in your own words, and then we say, take it to the next level and say, we're going to bring in a professional, and we're actually going to kind of remove some of that maladaptive thinking and replace it with healthy ones. And then we're going to reiterate that whole cycle again until it becomes rote with these new healthy behaviors. So feel really strong about our competitive advantage.
Kim, could you just elaborate a little bit more on the organizations that are driving people into the Relief and Feel program, as well as, do you have partners with therapists and whatnot that would also drive greater adoption?
Yeah, exactly. So today our model is selling into payers, and by payers I mean mainly it'd be health plans, but we, since COVID, we're also going after the employer space. Employers are very interested in mental well-being, resiliency programs because of all the changes. So that's the main area we're going after. We train and employ all of our own therapists. However, if we were to partner with someone like Kaiser Permanente, who has 1,000 of their own therapists in-house, we absolutely would work with their network. The only thing that we would do is, instead of just saying, oh, here's our app and our device, you use that in conjunction how you always do your therapy. We have to train them on our 16-week protocol. Like, we have a very specific protocol on how to use our data and fold that into a therapy session, a coaching session. So we absolutely can work with these other networks. We just go through, training them on our protocol.
All right, we need to move on. Awesome question and very, very interesting. I have to say that I am reminded of a kind of nostalgia for mood rings back when I was young, right? I think that we've taken this to a different level now.
Yeah, a little bit. Do I need to make you host or anything?
No.
Okay.
I'm just going to make the next team host, and that's going to be memorywell. So who am I flipping this over to at memorywell?
It's Jay Newton Small. Hi.
There you are. Actually, Kim, can you pass it over to Jay? Do you see Jay in the panel? Great.
Oh, there we go.
Great. All right, so 3 minutes.
Hi, everyone. So my name is Jay Newton Small, and I'm CEO and founder of memorywell, which is a digital platform for life stories used to improve health outcomes. So memorywell grew out of my experience caregiving for my father, who had Alzheimer's. And a few years ago, I moved him into a community. And when I did, they asked me to fill out this enormous 20-page questionnaire about his life. And I was sitting there struggling to write down the answers to these questions, thinking, I was, a White House correspondent for Time magazine at that point, and even I couldn't answer some of those questions well. Like, describe your parents' 50-plus year marriage in 4 lines. It's like writing haiku. And B, who could ever remember 20 pages of handwritten data points for the nearly 100 residents there? Nobody, right? So instead, I handed in the form blank and I wrote down his story, and it really transformed his care. 2 of his caregivers were Ethiopian, and they'd had no idea that my dad had actually lived in Ethiopia for more than 4 years early on in his career with the United Nations, and they became his champions. And memorywell grew out of that experience, and I left Time staff in early 2017 to start the company, memorywell, and we now have a network of more than 700 writers across the country, and we work mostly B2B with home care, palliative, assisted living, hospice. We're doing our first pilots with hospitals and insurers to basically replace large swaths of those biographical questionnaires that nobody loves to fill out and even fewer people read, with brief, professionally told stories that we then host digitally, and families can add to them their loved ones' favorite photos, music, movies, so whomever's sitting with them, whether it's a paid caregiver or a grandchild, has a whole toolbox of things with which to engage that person. I think the thing that really distinguishes us is our use of writers in this space. Most of our competitors are in the legacy space, and most of them are do-it-yourself versions of digital questionnaires or video questionnaires. We feel it's important to use writers because not only do the writers synthesize all of this information into an easily digestible story that really, brief story that frontline caregivers can more readily digest, but when they also file the stories, they file keywords, and that builds structured databases that are mineable. And that's really an attractive data set for a lot of our providers and customers. We collect about 72% of what's traditionally considered social determinants of health. And these are really rare data sets that people are hard to get to. So for example, family dynamics, issues of trauma, religiosity. And so we believe as we start to scale across the next 5 years, our goal is to do 1 million stories. We can weave in AI and analytics and really build almost like a Nielsen rating system for social determinants of health, which would be a game changer in this space. We're starting our first data pilot actually in the first quarter of 2021 with Kaiser Permanente in Northern California. We also have some other great customers, as you can see. We've raised about 1.3 million, mostly from angels in this space, like One Medical founder Tom Exley, and our round was anchored by the Dolby Family Fund. We're about to launch an official seed round, which would be our first price round. We're in Techstars right now in Washington, D.C. It's the future of longevity, and we're going to sort of raise the round around that. We're the perfect people to do this. We're a group of journalists, technologists, and we have great advisors in the healthcare and financial space. And so we're memorywell, and we are putting the person into person-centered care. I'd be happy to take your questions.
Hi, Jay. Thanks for sharing your story. It's great. I'm wondering, from the business point of view, what the business model looks like, what the revenue model looks like.
So sure. We work, as I said, B2B, and I would say most of the payers and people, like hospitals and providers that are interested in our business, it's mostly for value-based care. So, and to really improve value-based care scores, and that's, in the era of telehealth. For example, we're starting a pilot with MedStar, which is a hospital system in the Mid-Atlantic. In the era of telehealth, all of those investments in like valet parking and swanky offices are not very helpful. So being able to really empathetically connect with your patients is really appealing. And so, we really can help improve value-based care scores. And there's whole sections of health outcome surveys that we directly speak to. For example, how well known do you feel about your providers? And so we also, and then, obviously, I think in the senior living space, especially in the era of COVID, we better connect families and residents and staff when families can't visit.
Are you guys working with any Medicare Advantage plans, or do you plan to? I feel like the whole value-based quality proposition would work really well there. And do you see yourself licensing out the data or the technology in the future when you have like a more robust data set of, kind of structured social determinants of health data?
Yeah, so we started a pilot with Clover Health, and then Clover fired their entire innovation team, so that kind of collapsed. But we're in talks with Anthem and with Fallon Health to do pilots with them, which are Medicare Advantage plans, obviously, to be listed as supplemental benefit with them. So yeah, we do think that we have a really good, and I think it's a good path for us as Medicare Advantage. In terms of data, I think the first pilots that we're going to do in data would be more along the lines of Kaiser. So Kaiser, we're doing this pilot called Thrive Local, which started in the Pacific Northwest, where they created algorithms for all of their members, took their health data, their social determinants of health, and their information from on the ground. So what churches and clinics and senior centers were doing, and then basically made recommendations. So if you live, if 3 bus rides away from your nearest dialysis center, you're probably at risk for an episode, and it would recommend another dialysis center that's 2 miles farther away but offers free Uber rides. But where Kaiser really struggled was in collecting social determinants of health. So in the era of Facebook, when you're sending out questionnaires and have telemarketers calling people, asking them where they went to school and what they studied and where they go to church, people are resistant. But people love telling us their stories. 96% of people love the interview process. They love the stories. They actually even love the idea that their providers have these stories. They want their doctors to know them. They want their ER physicians and radiologists to be able to engage with them. And so when we do the stories, we're very upfront. We're going to give this information to your provider, and people actually really enthusiastically want to do that. And so we're one of the few solutions, and I think right now, where people are really excited to tell us a lot of things about themselves because they love the stories that come out of it. So sorry, that's kind of a short, long way of saying that I think that in the first sort of pilots or the first data sets that we'll do, it'll be very localized to those specific patients. But down the road, I think once we are at scale, we can weave in more analytics and AI and really provide, I think, some fascinating insights across the social determinants of health spectrum.
So we have a question from Andrew King, an attendee. Are you able to see that in the chat, Jay?
Well, because I'm sharing my screen, I can't see.
Oh, that's right. I'll read it. So home health, skilled care tends to focus on the nurse interaction with the patient and patient's family. How do you navigate being an outside party telling a story, particularly with aspects of the elderly showing their best side when a doctor is in the house? How does a provider handle you handing over that information?
I'm not entirely sure I understand the question, but I guess I would say that in terms of, getting to know, we have a platform that we've built, and so providers have like actually a paid caregiver page, which is only accessible for them, which has like all of their favorite music and movies, arts and readings you can play directly from there. If you're on a GrandPad, where we integrate with them, or if you just have an iPad or a smartphone or any internet connection. So it gives them a whole toolbox of things to engage those people with. And we found that the timelines that we have in the era of COVID, when family can't visit, we've seen a lot of paid caregivers shoot little videos or photos of the people that they work with so that they can and put them on the timeline to reassure families that they're doing okay, and like they're and they'll do, we also send weekly engagement questions, like where were you during the moon landing, different historical questions to prompt them to answer things. And then families engage around that and comment about, like, oh, it's so interesting, you were like at, your sister's house or wherever it was during the moon landing. In terms of the way that, we get paid caregivers to interact, we've actually gamified the back end. So we ask them trivia questions about their patients, and the person who answers the most number of trivia questions correctly each week can win an Amazon gift card, which for a lot of frontline caregivers, just a little bit of money an extra money can go a long way. So we try to make it fun and also, beneficial for them.
All right, awesome. Thank you, Jay. That's time.
Thanks.
And great job. We're going to move on to the next one, which is going to be Graphite RX. So Jay, could you please pass it over to, I think it's David
Silverman.
Yes.
So how do I do that?
So click on his image in the panel, and the menu will allow you to pass it over.
There you go.
Perfect. Thank you.
Cool. Give me a second and I'll get up on my side. Cool. Is everyone able to see it?
Yes.
Okay, thanks. So I'm David Zilberman. I'm the founder and CEO of Graphite RX. This is actually my second startup that Columbia has supported me in. So I actually wanted to start out by just saying thank you. My first one was in 2010. I'm a CBS 2012 grad. So for a while I was on the program, I got support, and actually through Columbia and CVC, I actually got one of our 3 investors came through that network. We also got a term sheet from another investor that we didn't take. So very grateful for the support to date. And kind of my, before I get into the details of the business, I just wanted to kind of offer, and me giving back a little bit, is happy to provide any kind of peer-to-peer support as a founder for any women founders, people of color, LGBTQ, veterans. I think we need to see more of it. I'm really proud to be on a panel where 3 of kind of, my co-panelists are women. So I think it's awesome. I think it says a lot about CVC. So just wanted to kind of give that as just a little bit of a shout out. So did my slide go away? Bring it back. So Graphite RX. Graphite RX is a B2B marketplace for pharmaceuticals. I spent 6 years, after I shut down my first startup, I spent 6 years working with one of the large pharmaceutical wholesalers in the United States, and really felt and identified a need that existed. It's a very large industry, about $450 billion a year flow through the United States from a pharmaceutical perspective, and about 330 billion of that flows through the large wholesalers. And the biggest challenge is when you're outside of that wholesaler channel, there could be a lot of waste in how drugs are distributed. This waste has an impact on access that patients have to care, especially when we're talking about pharmaceuticals like specialty medications. And the more inefficient the system is, the impact that it has not only on patients but also on the providers that provide care. And so there was a recent stat that the number, over 100 hospitals have closed in the last decade, and that's because they couldn't remain financially viable. And so one of the questions that I asked in researching Graphite RX before I started, I said, well, why is that? Why is that happening? And when you look outside of, within this industry and kind of outside of this wholesaler channel, you really see kind of a mess. You still see manufacturers that accept orders by phone, fax, and email. Some of them have portals. And this is something that I felt that technology could fix that. And so I asked the question, what if pharmacy purchasing was as easy as ordering from Amazon? And so about 3 years ago, I started with those questions and reached out to pharmacy directors, supply chain vice presidents, folks at manufacturers and distributors. And, there was certainly an interest in having a way of being able to distribute pharmaceuticals in a way that's smarter. So Graphite RX is a marketplace platform. On one side, we serve pharmacies and clinics, so that's the demand side of our marketplace. On the supply side, we serve suppliers and manufacturers. Just to give you a sense of the size of the market, so of the $450 billion a year, about 120 billion of that doesn't have an organized way of transacting. And so you have 70,000 pharmacies, 250,000 clinics buying from over 1,000 suppliers. Today, we currently have 28 hospitals. So we just this week onboarded our 28th health system hospital. We just launched in June, and they purchased from over 120 suppliers. And our current gross merchandise volume, or GMV, or value that's flowing through the platform, is about 65 million annualized from a GMV perspective. We also launched a free product for COVID. So when COVID-19 started, we saw that health systems were struggling and getting critical and essential medications. And so our team decided to drop what we had in on our roadmap and instead focus on the COVID crisis. And we launched a product that essentially allows pharmacies to help pharmacies deal with drug shortages. Just something that we take a lot of pride in is, we have a customer that equates us to something kind of between an Amazon and a pharmaceutical wholesaler in terms of what we're able to provide and the value that comes with it. So as I mentioned, we launched commercially in June of 2020. We currently have 28 health system hospitals. We have another 32 that are actually in the onboarding queue. And we also recently signed GPO contracts, or group purchasing organizations, that give us access to 4,000 hospitals and 35,000 clinics.
David, that's time. We're a little over. If you could wrap up.
Okay, you got it. So I just wanted just to end with, we talk, in pharmacy supply chain, it's not really a sexy business from that perspective. You talk a lot about efficiencies, but really the reason we do what we do is we believe that if we can help suppliers and providers win, then patients win, and that's a way for healthcare to win. So thank you.
Questions from judges?
Yeah. Hi, this is Bernard. Are you only going through hospitals and clinics, or also the retail side?
So we decided initially to focus on health systems, because health systems had the largest, kind of the most significant pain point from that perspective. They also aggregate significant volume as well, and so that's where we started. But we'll be expanding also to independent retail as well as physicians' clinics in the future.
Do you interact with PBMs at all? Or are they squeezing you here?
No, PBMs actually aren't really part of, they're not relevant to the supply chain aspect of it. They obviously decide on the formularies, and the formularies ultimately decide on demand and impact demand, but they're not really relevant from this perspective. Kind of the players in this are the buyers, which are the providers, the manufacturers, the distributors, and in some cases the GPOs as well. Yeah, PBMs don't actually move product. They don't deal in buying and selling, right? They set formularies and provide awards.
What do you think a sustainable take rate is for a marketplace like this?
That's a great question. So today, just to give you a sense, branded manufacturers are probably paying anywhere from 8 to 12%. If they're smaller branded manufacturers, and if they're a generic, then anywhere from 25 to sometimes upwards of 35 or 40%. We're looking at a blended take rate of 3.5%.
What are the switching costs, I guess, for both sides of it, for hospitals in particular?
Really there isn't a switching cost, because today what happens is a hospital, so the vast majority of what they're buying, 80 to 90% of their needs is through a single wholesaler. It's that other 10 to 20% that they're buying from. It could be anywhere from a dozen to 50, 60, sometimes 70 different vendors. And so they're not switching from them. What they're doing is they're bringing all of their vendor relationships on our technology platform so that they can essentially have a one-stop shop where they're able to place all of their orders and manage those relationships through our platform.
We have time for another question, and I see attendee questions. Rich asks, how do you get paid? And are you raising money?
Yeah, great question. So we raised $3 million to date as part of our seed. We are going to be accelerating our A, given some opportunities that have arisen recently. So we're going to be accelerating that. Our model is one where it's free at no cost to the health system pharmacies, and we do charge a take on the supplier side. And so we'll be charging a take as part of our business model. We decided to not really worry about that until we hit significant scale. So when we hit about 150 million in GMV flowing through our platform, probably mid next year, is when we're really going to be able to turn on the take in a more sustainable way.
All right, that is time. So we're going to move on. David, thank you so much.
Thank you
for your presentation, and thanks for great questions on that one. I believe the next one is DoBrain. So David, could you transfer host to DoBrain? Just click on, is it Joe or Yejin that is going to be presenting? Which one of you is going to control the slides?
So I hand it off to Yejin.
Great.
I have, oops, can you give, Yejin, can you give it to me, please?
Unfortunately, guys, I'm the host for another Zoom call, so I have to drop now, but it was great to meet all of you. It's a pleasure to get connected, and I'll just, I think you have my contact information already, but
Thanks, Chris. We appreciate you spending the hour with us, and good luck with your other call.
Thank you.
All right, take care.
I think I'm the host.
Yes, you are.
Did that work? Is everyone seeing the screen?
Yes, we do.
Okay. All right. Hello, everyone. It's a pleasure to introduce DoBrain. My name is Joe Lim. I'm CEPA 14 graduate, and Yejin, our CEO, is with us on the call. I came to know DoBrain. I came to know DoBrain when DoBrain won first place in the UN competition I was organizing. And about 4 years later, now I'm the one telling you how 1 out of 6 children experience developmental disorders, and how 93.7% of them do not receive proper treatment. We actually found out that the current options are hugely expensive. They are also far away, and they're not designed for children. If you ever wanted to get your child tested, diagnosis cost over $300. Treatment cost would be over $100 per hour. If you're willing to be treated, then you have to wait about 145 days in line in certain cases. Treatments are most effective when provided under age 6 because our brains are majorly shaped during this time. The screen on the right here, which I showed you before, is what children get when they go into therapy. It's old, it's text-based, and it's not suitable for children. We thought we might be able to change this. So what we came up with is an app that brings the hospital on a smartphone. 30 minutes on our app, we can tell you with about 93% accuracy if your child suffers from developmental disorder. And our AI diagnosis is just getting better as that data is stacking up. DoBrain also utilizes AI to achieve major improvements, including over 13 IQ points if you consistently play DoBrain for 12 weeks. And that once we diagnose children, we bring them to a learning course or a therapy course, depending on their needs. Now, this is a video that I would like to show you. It's very short. This is a program in Cambodia. This 5-year-old autistic boy shows a general lack of attention. He beats his chest, which is a common sign of autism. Autistic children also have a terribly difficult time making eye contact. This is 12 weeks later. He's been doing DoBrain 3 times a week. And you can see that he's much more calmer. He's present. And he makes full eye contact, and there's very little distraction. And his parents were especially amazed. For non-disabled children, we also provide over 12,000 clinically tested content proven to raise IQ by at least 8.5 points. And very excited to see about 450,000 organic users on our free app, positioning DoBrain as a leading app in a rapidly growing industry, which is expected to grow by 4.3x by 2026. We are looking by 2022 to get our first FDA and CE certification in digital treatment. We are currently approved in an emergency use authorization because we fall under the right category due to COVID. Right now, we actually have no issue being working as a treatment. We just closed our 5.5 million Series A round in July. And we're looking to go global, which is our important theme for 2021. We're looking to launch in the US and in India. This is the powerhouse that brings this is actually a secret sauce, an incredibly smart and determined team creating and testing life-changing content. Won a few awards, including the one that I was hosting. So DoBrain is an incredible experience for children, especially because we found out that increasing 1 IQ point before 5 is the equivalent of 3 raised IQ points by the time the child is 16. So the effects on children is huge, and our success, DoBrain's success, not only creates better cognition for disabled children, but it affects their lifetime income, life expectancy, and we hope to onboard you in creating these changes. Thank you.
Thank you, Joe. Questions from judges?
Can you talk a little bit about the pathway for establishing clinical efficacy, like what studies you've done, what studies you plan to do, and then what's the plan after the FDA lifts the emergency measures, and then just in terms of like monetization, I'm guessing it's direct to consumer now, but how do you envision it once it becomes a therapeutic? Like what's the economic model there?
Yeah, we've done a few, actually we're on to our 11th clinical test right now. I think Yejin has a lot more better information on how we set it up. Yejin, you're muted, I think. Yejin?
Yes. We did 11 clinical trials, as Joe mentioned, and 4 trials are just finished, and we showed the test case with using DoBrain showed amazingly raising IQ scores. And
how was that set up? If you could explain how the control and experimental groups were set up.
The control group used TAU, treatment as user. And they used the placebo application, which doesn't have the effect of developmental development effect.
Right, and so we have done about 8 tests inside of Korea, and 3 other tests were done in various regions around the world. One being Harvard Medical, which is still in process right now, and that test will also involve about 80 users in testing out DoBrain's efficacy. After FDA is another question. I mean, the FDA right now is taking some time. Our research is been delayed about 6 months because of COVID. But after is another issue that we need to talk about. We're usually, I mean, a lot of the companies that went before us have utilized a B2B2C model to work with hospitals as well as other corporates to launch the model. I mean, to scale the model.
Any other questions before we move on? All right, Joe and Yejin, thank you so much. Really awesome product. I might be a bit biased. All right, great. So let's pass it over finally to Bon at Phyto.
This is what the world increasingly looks like. Diabetes and obesity are now global epidemics. And the numbers involved are truly staggering. There are over 1 billion people have one or more of these conditions, and current medicines and methods available have failed to stop its growth. The world needs a new way to fight this. I'm Bon Macy, co-founder and CEO of Phyto, and we found that new way. Essentially, we hack your hormones. Our approach leverages the power of your own metabolic system that nature designed for you. The metabolic hormones it releases are way more effective than any drug at safely controlling blood sugar and insulin release, controlling appetite, food intake, and weight, and managing digestion and improving metabolism. Now, inspired in part by the remission of diabetes realized through bariatric surgery, our team of scientists figured out and demonstrated the cellular receptor network triggers for this system. And based on this, they delivered a platform of therapeutics that work completely safely and entirely in the intestines and work powerfully to activate this metabolic system and therapeutically boost and restore the release of key incretin and metabolic hormones, then reversing diabetes and reducing weight. Now, the leading class of diabetes drugs in the market today are essentially only trying to partially mimic the full extent of what we actually do. Our approach is fundamentally better and safer. Now, the breadth of our technology platform, delivered by our science, creates a full range of potential products. Not only can we produce pharmaceutical agents, and we have 3 of those in development, but we can also create highly effective ingredients for functional foods, groundbreaking medical foods, and other nutritional products. You know, these are big markets, and there are several competitors for sure, but we have a significant competitive technological advantage. Think about a product like SlimFast for dieters or weight loss. Adding our technology that will actually control appetite for 7-8 hours or more. Or take a look at a product like Lucerna for diabetics, but with our ingredients that will actually actively control your blood sugar rather than just provide passive nutrition. Now, we've got a partner to get our first nutrition product into the market. We expect that to occur in about 6 months at this point. So it's to follow a clinical trial that is finally now ready to start at UCLA after being delayed by COVID for several months. Of course, we've got a team to get this done. You know, we combine basically a leading international authority on metabolic disease in the pancreas with decades of experience in international business, tech commercialization, as well as startups and entrepreneurship. We've got a great group of advisors that really represent international expertise on 3 continents, basically additional leaders in metabolic disease and the pharmaceutical industry. We're looking to raise our seed round now, and we're happy to take your questions.
Questions from judges?
Can you talk a little bit more about the safety and efficacy studies that you've done so far, what you plan to do, and then in terms of the FDA, what types of claims are you allowed to make on, I'm assuming this is like a medically tailored solution or a nutraceutical.
Yes.
What's the
there's a range of things. So there's a pharmaceutical side of this, and we can make those claims based on obviously going through, you know, phase 1, phase 2, phase 3 trials and all that. On the nutritional side, the nutraceutical side, functional food side, we will be able to make structure function claims. We'll be able to claim, the only thing we can't claim basically is that we treat a disease. We can say we control blood sugar, we can say we release metabolic hormones, and there are various other sort of structure function claims we can make. We've done a lot of, let's see if I can get down to some of the slides here. So we've done a lot of proof of concepts. This shows the extent of hormone release we can generate from, this has been in mouse and rat models and human in vitro cells. So there's that. The chart on the right shows one of our techniques for delivering the compounds to the intestines. There's basically a molecular complex that reduces intestinal absorption, which actually increase the efficacy and safety of the molecules. Here's a 8-week-long, mouse study showing significant declines in diabetes markers, HbA1c, and fasting blood sugar, glucose. Another study showing significant reductions in food consumption and body weight over a test period. And we've been waiting to do a human trial and demonstrate this in humans. That's been delayed about 6 months due to COVID. But we finally get back up and started at UCLA, and IRB just approved it, actually. So we're trying to getting ready to schedule that.
I see a question from Murray. How is the customization determined, i.e. hormone diagnosis? How's the hormone diagnosis done? Blood, saliva, what kind of test?
Oh, we don't test someone for diabetes. We treat it. And so person will have elevated blood sugar levels, by basic, blood glucose meters, testing from blood samples. And so based on that, or if they, they're overweight or obese or want to lose weight, that's another avenue that we can affect purely through the hormones that you produce. Now, one of the things I didn't mention before, you mentioned about safety. We can do this with known safe molecules. And so that's a huge advantage. And then the ability to restrict them to the gut and prevent systemic absorption further eliminates any sort of potential side effects.
Any other questions from judges or attendees? All right.
That's quick.
Bon, thank you. Well, it actually brings us right up to time almost perfectly.
Mm-hmm.
So thank you for presenting Phyto. And so now, Bon, could you send the host, could you make me the host, that is, again, please?
And how do I do that?
So hover over my image, and then there's a little blue button with a menu, and make me host.
There you go. Did that work?
No, I don't need the invite. Let's try it again.
It had to, because I can no longer do it.
Okay, hold on one sec. Well,
Yeah, Bon, we're still seeing your screen.
Yes.
You might want to try that again.
Okay.
it doesn't give you the option to make me host?
It gives me the option on your for chat and pin.
Well, I'm not sure then what to do.
I just tried to share my screen. It says host disabled participant screen sharing. So I'm not the host anymore.
Well, I don't know if I'm the host either, because I don't see my full menu bar. But that's okay. So let's do this. Since I'm not going to be able to create a breakout room for the judges. Judges, why don't you chat in the internal chat instead of, it would be better if you could speak with each other and deliberate, but at least you can chat in the absence of a breakout room. Does that sound okay? So why don't you share your thoughts? If you have like a clear winner in your view, or top two, however you want to do it. And then the rest of us will stand by for a few minutes. All right, we're almost ready, everybody. Thanks for your patience. All right.
Ryan, can you hear me again?
Yeah, Narmeen, we can hear you.
Awesome. So what we were thinking was we would just give a little pieces of feedback to everyone, and then potentially just pick the top two, and I'll just deliver it in the interest of time, if that works.
Perfect.
So I'll start in the order that the presentation started. I think it's really smart that you guys are focusing on measurement-based care. There's almost none of it in mental health, and it's so unscientific compared to a lot of other areas of mental health. And so I think that that's in particular very important. I really like the areas that you're focusing on, especially PTSD and ADHD. I think there's very few people kind of focusing in on that space. The piece of feedback that I would give is I wonder if you could partner with kind of large institutions that have a high cost of dealing with these problems. So like, for example, the VA, the military for PTSD, et cetera, et cetera. And so I'd love to, kind of connect offline and see if I could be helpful with like my resources or connections and connect you to people that might be interested in these spaces. That works. Who's next?
Thank you. Thank you for the feedback.
memorywell is next.
memorywell. So I really like the strategy of creating this like analytics platform around social determinants of health. I think it's really like a critical part of like rolling into value-based care. And obviously the aging space is really important right now as our boomers kind of age. The thing that I would kind of consider maybe thinking about a little bit more is like, how do you potentially monetize and maybe even license kind of like risk stratification data or analytics with Medicare Advantage plans. And I'd even consider some of the like really large provider groups like a Landmark Health or something like that. But I think it could be something really value add because it is really hard to figure out, who's most at risk without getting these like social determinants of health data. And there's really no good way at the moment of getting it. And so I think that that's definitely really exciting.
How about Graphite RX?
Thanks so much.
Yeah, this marketplace makes a ton of sense. I think there's a lot of fragmentation. And so I do think it's one where like the efficiencies make a ton of sense. And obviously seems like you've seen a ton of traction even in the last few weeks. The take rate, I was actually really interested to hear that you thought the take rate would be 3.5% like sustainably. And so I'd be curious to learn a little bit more about like at what scale you could achieve that. And like if there's comparables that have kind of done it at that place. But I really like the product. I think obviously like there's a missing piece of efficiency here. And obviously the space is like quite a mess with how people get supplies at the moment. And so I think that's very, makes a ton of sense. Who's next?
Thanks, Narmeen.
Dubrain or Phyto are remaining.
Okay, I'll do Dubrain first. I like that you guys have started doing all of these studies. It seems like most of it has been abroad. And so I think one of the really interesting pieces to see will be when you do like larger scale studies in the US, what the results are. And I'd be kind of more curious to hear how you think about monetizing kind of just beyond direct to consumer. I think there's some interesting models that we've seen with digital therapeutics, paratherapeutics, for example. And so maybe that's the area to kind of focus on, like once you get, kind of the regulatory process and the approval process through, what's the right model to monetize this? Because I actually do think from a cost savings and an economic ROI perspective, it probably makes a lot of sense for a lot of people who actually can't afford care and so and afford treatment in this area. And so I think that would be the piece I would think about next. And then Fido, it seems like you guys are kind of gearing up for your big human study. And so I think that that's probably the critical next milestone to actually get this like efficacy and safety data in people. And so I think that that's great. The other piece of feedback that I would give, and I candidly haven't really looked at much in like kind of the nutraceutical space, but kind of all this stuff around like claims and like FDA and what you can claim, what you can say. And then, I'd be kind of interested to learn more about the patented process that you had mentioned about how it stays longer in your gut and the reabsorption is slower. And so I think that would be the interesting piece.
Great, thanks very much.
Narmeen, do you want to say who you think came out on top?
I would say the two people, or the two teams I would say that came out on top potentially were Graphite RX as one, and then memorywell would be the other.
Do you have any feedback in terms of overall presentation? Any recommendations for any of the speakers around the actual delivery? Any recommendations there outside of just the content that was presented?
So I thought overall everyone's presentations were really good. I think when I was a healthcare investor, the couple of things that I would look at kind of upfront was, clinical efficacy and regulatory pathways. And so I know it's harder for early stage companies, frankly, I think about it all the time as a founder now. It is obviously very hard when you're starting, but it is a thing I think that investors think about a lot when they think about time to monetization. So I think that piece and kind of mapping out when that happens can be really important for basically everyone.
It's like good old customer validation, right? But more
it's
important.
Really hard in the therapeutic space, admittedly.
Right.
It's takes a while to prove these things.
Yeah. All right. Any comments or feedback from other panelists? Feel free to chime in before we wrap up. I just want to look at one more slide and then we'll be done. Great job, everybody. Any comments? All right.
It was a pleasure being here, guys. It was nice meeting most of you, all of you. It was a pleasure meeting all of you.
Well, congratulations to all the teams. Pitching is challenging, right? It requires a lot of practice when you do it in person. And in this format, I don't know if it's easier or harder, to be honest. It's just different. And, what's good is that we had a great audience. And I think that, we'll be able to do more of these virtual pitch events moving forward. We learned a lot tonight, and we appreciate everyone's participation. Just to wrap up, if you are not already a member of CVC, we encourage you to become a member. If you're a Columbia alum, you can go to meetup.com/ColumbiaVC. We just ask for your uni or your Columbia email to validate that you were affiliated with the university, and we have all our social media listed here as well. And if you're interested in volunteering with CVC, there'll be a link in the slides that go out, but you can also go to this link right here in the lower left corner, and you can apply to volunteer. All right, well, thank you again to everybody for a great event. We are finishing basically right on time. That's a miracle with me. So thank you, everybody. And we will follow up with a link to the recording and with the slides. So looking forward to your feedback. And if anybody has feedback on the format of this event, this is the first time we've done this virtually. We would really love to hear your feedback and ways that we can improve the format next time.
And thanks to the CVC team. It's an awesome job.
Our pleasure.
Thanks, CVC team. It was so great for all your work on this.
Remember, we have 10th annual New York Demo Night, October 14th, and our first London Demo Night on October 21st, and our first Pan-Asia Demo Night, likely November 10th, but we haven't confirmed the date yet. So we have a few more of these and hopefully even better. So we hope to see you at those as well.
Well, Ryan, the in-person events always have booze. So maybe we, at the end of the event, we just raise a glass, everyone from their own stash.
I was thinking that we could do that. I was thinking encourage people to have a glass of wine while they're watching. But I figure we can layer on complexity as we move forward. And, I'll certainly have a drink or two at the 10th annual in a couple of weeks.
Right on.
Hope everyone else can join that. All right, folks. Again, we'll share the slides and the recording afterwards. Thank you so much for your time. Have a great night, and we hope to see you at another event soon.